For a full mouth reconstruction case, we would have initial consultation where we gather all the information for the patient, such as cone beam, x-rays, models, pictures, anything that will help us evaluate the function, the aesthetics of our patients. At that point, we will establish the overall goals and desires of our patients. And sometimes we may need a second consultation to review all the findings and determine whether we need veneers, porcelain crowns, implants to achieve that desired goal. All these options will be discussed at the time of the consultation, and the patients will be provided with a detailed treatment plan that ultimately will give them the final result that they've always wanted, whether it's an aesthetic or function or both.